In this week's muscle breakdown, I don't have a muscle, I actually have a ligament, a specific ligament in the shoulder, better known as the posterior glenohumeral capsule. This capsule is very involved in a vast array of injuries, specifically in the shoulder, like impingement, rotator cuff tears, and just overall dysfunction. And it is very important to be able to assess it, to find it, and actually fix it. What's up, everybody? I'm Dr. Matt Maggio. I'm the creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists how to easily double their income, all while working less and being taken seriously as a healthcare provider. In today's breakdown, we're going through the joint capsule in the shoulder. Now, the joint capsule is actually a ligament. So it sits in a very particular place in the shoulder. And as we go through the video, I'm going to break down a palpation for that as well. But the capsule really needs to lengthen anytime you're moving the shoulder through range of motion or through space. And a lot of times, shoulder problems begin with dysfunction in the capsule. So the capsule doesn't get as much blood flow and as much oxygen. So when it does get jammed up, and a lot of times it gets overused, with bad posture, overhead use, and things like that, it creates a lot of problems. And then what it does is now when the shoulder goes to open up, it can't open up freely how it's supposed to. So then it requires the surrounding structures to have to work a lot harder. And a lot of times that ends up being muscles in the rotator cuff, specifically like supraspinatus, infraspinatus, and subscap. Those are usually where you get a lot of clients that come in and they actually have tears in those tendons that cause bigger problems because they're having to put more force in there. So the capsule is really like the capstone of how the shoulder is moving. And when the capsule can't open up because it's getting overloaded with scar tissue, it has to rely on a lot of different areas in there. So a lot of like chronic shoulder injuries end up having a capsular component to this as well. And a lot of times people end up getting like a rotator cuff surgery, or even worse cases, they go in there and get like a labrum tear fixed as well, or better known as a slap tear. But a lot of times there's dysfunction in that capsule that they never actually fix, so that problem comes right back. Now, the key is actually finding the capsule. So where the capsule lives, I'm going to get my model in here. Where the capsule lives is right on the back part of the humerus, right where the scapula comes in. And basically on one side of it is going to be the posterior delt and the other side is going to be the tricep. And usually what happens is when people are palpating on that capsule, they're either on the posterior delt or they're on the tricep, and they're not actually on that capsule itself, because when you go in, you should actually be able to sink in and feel that really deep. So what I'm going to include in this video is the palpation training from the Peak Method, so you can really get a better idea of how to find that capsule, because as I always say, you can't fix a problem if you can't find it in the first place. So check this video out. Next thing we're going to do is we're going to palpate into the capsule. The capsule is really important for overall function of the shoulder, and it's usually really deep and it's difficult to get to, and a lot of people are too compressive. So what we do is we have the patient lay down on their side, right through here. And then the way I like to palpate the capsule, it's coming a little closer for me, is I'll take this arm right here and let it relax. And then essentially what we want to find is some landmarks in here. So I find things that I know. I know this is the humerus, and then essentially where the capsule lives is right between the posterior delt and where the tricep comes together. Usually what happens when people are trying to treat this capsule is they're too much on the posterior delt or they're too much on the tricep, and that makes a big difference. So you can see I'm sinking in. I know this is bone, tricep, posterior delt. I keep working my way back, until I come into the scapula where everything comes together, and that capsule lives right there. And you can see I can really sink in on it and feel that. If there's tension on that, that's telling us there is some scar tissue in there. And if you find it, get in there, put some tension, put some depth on it, and break that down. But the key is slowing down to find it. It's a structure that is very overused in a lot of shoulder problems. I hope that palpation video helped. I always say watch those videos over and over and over again, because if you can get better at palpation and finding that, you can fix a lot of dysfunction. Now, the thing about treating a capsule, which is way different than what I teach in other muscle treatments. So with muscle treatments, what we have to do first is we have to get proper depth, back out a bit, and then some tension. I've shared in some other videos the idea of like internal versus external slide. Now, when you're treating a capsule, it's really bound up. It's kind of like a ball of yarn that's all together and really jammed up, and it actually needs a lot more pressure. So for you people that like to go really deep, this is actually a better one for you if you can actually find it, because a lot of times, like I said, you're going to be stuck on either that tricep or the posterior delt, and all you're doing is jamming on tissue that hurts. You're not getting an effective treatment. So when you treat the capsule and you go in there, you get depth, but you don't back out, and then you set the tension. And when you can open this up, it can really free up that motion in the shoulder. And a lot of times in our shoulder evaluations, what we're looking for first is just like global motion. We look to see, can the client do this? Can their arm come up nice and free and touch their bicep? I don't care as much about internal and external rotation as other people do, because those are secondary motions if you don't have that global motion there as well. But when that capsule is really bad, it can put a lot of wear and tear on the rest of the shoulder. Sometimes people might even feel that like impingement type of feel in the shoulder. The problem with impingement, it doesn't tell us anything. I always say you have to have a tissue-specific diagnosis for it. Problem impingement doesn't tell us anything, but a lot of times there's a lot of dysfunction in that capsule. And if you have shoulder cases where maybe you're treating them for spinatus, maybe you're treating subscap, and they're not really getting better, a lot of times there's a bigger problem in that capsule. And when you can go in there and find it and you can fix it, you make a difference between your client getting temporarily better or getting better for good. So hope you guys enjoyed this video. I really enjoy making these. We're getting a lot of comments and shares on them. If you ever have any muscles specifically that you want me to cover or talk a little bit more about that, let me know. Send me a message. I'm always here to help. And lastly, if you're kind of sitting on the fence about getting our free training or even becoming one of the Peak Method trained providers, now's the time to do it. People are killing it left and right. They're doing really well with this, and they're getting taken seriously as a healthcare provider and providing more of a functional based, soft tissue driven type of treatment. You can go from being a service provider to a solutions provider. All the information to get links into that is in my profiles, wherever you're looking at this. If you're watching it on LinkedIn, Facebook, YouTube, all the links are there. All you got to do is make that commitment and go out there, get the free training at least, give it a chance to learn what we do and change your mind and transform your business and your practice so you can help more people and help me on my journey to make chronic injuries obsolete. Appreciate you guys. See you on the next one. Bye.